Walking speed sounds like a strange thing to track in a hospital, but doctors in Japan track it anyway because it's one of the most accurate predictors of how many years someone has left. A study out of Fukushima Medical University followed nearly 500 older patients with type 2 diabetes, and walking speed alone separated the ones sliding toward frailty from the ones who weren't. Not blood pressure, not weight, speed. A research team in Nagano figured out how to rebuild that number in people as old as 78 and did it without a cane in sight. The viral Japanese walking trend you've probably seen isn't some ancient secret passed down through generations. It's a specific 20-year-old exercise protocol tested in a lab, published in real medical journals, and it works on a mechanism almost nobody explains correctly. Because walk faster sometimes doesn't make for a great headline. The protocol comes from Shinshu University in Nagano from a physiologist named Hiroshi Nose and his colleague Shizue Masuki. They weren't chasing a wellness trend. They were solving a boring practical problem. Continuous moderate walking, the kind every doctor recommends, barely moves the needle for older adults. People do it for months and their aerobic fitness stays flat. Nose and Masuki wanted to know why. What they found was that the body adapts to a steady pace almost immediately. Once your heart rate settles into a rhythm it can sustain forever, it stops working hard enough to change anything. The walk becomes furniture, familiar, harmless, unable to rebuild what age has been quietly taking apart. So they broke the rhythm on purpose. 3 minutes at a pace hard enough that talking becomes difficult, followed by 3 minutes slow enough to fully recover. Repeat that 5 times and you've done 30 minutes, and you spent half of it in a zone the body can't get comfortable in. The study group did this 4 days a week. Participants range from 44 to 78 years old, ordinary people, some sedentary. Before the study started, the fast interval forced real cardiovascular strain, the kind that triggers adaptation, in bursts short enough that anyone could survive them. Measured against a group doing the same total amount of steady walking, the results weren't subtle. Leg strength went up, peak aerobic capacity went up, blood pressure came down. The effect held specifically in the older participants, the ones every other exercise program tends to write off as too fragile for anything that raises the heart rate. Now here's where it connects to the pain. Joint pain after 70 usually isn't caused by walking. It's caused by the muscle loss that happens once someone stops walking because walking hurts. Take away lean muscle around a knee or a hip, and that joint starts absorbing forces the muscle used to handle. The joint gets blamed for a problem the muscle actually created. Pain reduces movement. Reduced movement accelerates the muscle loss, driving the pain, and 18 months later, someone who could once walk 2 miles is gripping a cane just to cross a parking lot. A cane, by the way, isn't the neutral safety device it gets marketed as. Leaning on one for a year straight lets the hip and glute muscles on the supported side go quiet because the cane is doing work those muscles used to do. Plenty of people who start with a cane for balance end up needing it for strength within a few years, simply because the muscle stopped being asked to fire. That's the exact spiral interval walking is built to interrupt. Interval walking breaks the cycle without asking the joint to absorb more impacts than a normal stroll already demands. One foot stays on the ground at every point in the stride. There's nothing here resembling the pounding of a run, none of the repetitive shock that makes jogging risky for a 70-year-old knee. The intensity comes from speed and effort, not from force hitting the pavement, so someone can chase a genuinely hard cardiovascular stimulus inside movement gentle enough for a person recovering from a joint replacement. Form matters more here than people assume. The traditional posture underneath this method traces back to something called Namba Aruki, an older style of movement that shows up in Japanese martial arts and traditional Dan long before any laboratory got involved. Spine tall, pelvis neutral, a slight lean from the ankles, never a slouch from the waist. Heel touches down first, weight rolls forward through the arch, and the toes push off last. That heel to toe roll keep the knee tracking correctly under low, and a shortened, quicker stride, something close to 180 steps a minute, keeps each footfall light instead of a heavy plan that jars straight up the leg. Here's how it actually breaks down if you wanted to start tomorrow. Week 1, walk the pattern at a gentle version. 3 minutes brisk, 3 minutes easy for 4 total cycles instead of 5, and don't chase speed yet. Just get the rhythm of switching under your skin. Week 2, add the 5th cycle so you're at the full 30 minutes. From week 3 onward, the only thing that changes is effort. The brisk minutes should feel like you could manage a short sentence, but not hold a real conversation. The slow minutes should feel like nothing at all. A stroll, a full reset before the next push. 4 sessions a week is the target the Nagano data use, but 3 still produces real change on a week that won't allow 4. What matters is repeated exposure to an intensity the body has to answer, not a perfect schedule. The Fukushima study is worth returning to for a second because the detail buried in it is stranger than the headline. Researchers weren't just looking at frailty, they were looking at mild cognitive impairment in older diabetic patients, and when they ran the numbers, gait speed came out as the single strongest predictor, stronger than grip strength, stronger than age itself, stronger than blood sugar control. A slowing walk wasn't a symptom sitting alongside the cognitive decline. It was arriving first, sometimes years first, which means the legs may be reporting brain trouble before any scan or blood panel picks it up. There's a reason Namba Aruki survived as a cultural memory instead of vanishing with the rest of pre-industrial movement patterns. It shows up in sumo, in Warriors Theater, in the choreography of traditional festivals, taught the way a craft gets taught, through repetition and correction rather than a manual. Modern researchers didn't invent the biomechanics. They measure what practitioners already knew by feel, that moving from a stacked upright frame wastes less energy and puts less shear force through the joints than the looser, hip-rotated gait most walkers fall into without thinking about it. The interval protocol borrows that frame and adds the one ingredient the traditional walk never needed, a sedentary population that has to relearn intensity from scratch. The most common mistake is underdoing both speeds at once, not overdoing the fast minutes. Someone commit to the protocol, then unconsciously softens the brisk phase because pushing hard feels unfamiliar after years of gentle walking, and the slow phase drifts up to match it until the whole thing collapses into one flat, moderate pace that delivers none of the interval effect. The fix is almost embarrassingly simple. Use a phone timer with a sound, commit to the pace, shift the instant it beeps, and let the first 2 weeks feel a little clumsy while the body relearns what effort is supposed to mean. Progress past the first month tends to follow a predictable curve. By week 4, the same brisk pace that felt maximal at the start starts to feel merely hard, which is the cue to push the fast minutes faster rather than longer. Some programs add a 6th cycle around week 8, stretching the session to 36 minutes, but stretching duration matters far less than protecting the gap between the two speeds. A brisk minute that isn't meaningfully harder than the slow minute isn't doing the job, no matter how long the walk runs. A few practical notes before starting. Supportive shoes with real cushioning matter more here than in a leisurely walk, because worn-out soles turn the brisk minutes into a jolt straight up the shin. Flat, well-lit ground beats hills or uneven trail for the first few weeks until balance and confidence catch up to the pace. And the difference between good effort and a warning sign is worth knowing cold. Heavy legs and louder breathing during the fast minutes is the workout doing its job. Sharp joint pain, chest tightness, or sudden dizziness is the body asking to stop, and that request gets honored immediately, every time. Once someone's moving that way 4 days a week, the changes stop staying local to the legs. Visceral fat, the kind that wraps around organs and drives inflammation, responds better to interval training than to steady cardio covering the same total distance. That matters because visceral fat also keep cortisol elevated, and elevated cortisol keeps stubborn belly fat entrenched in the first place. The fast, slow structure of this walk is one of the few free interventions that actually breaks into that loop from the outside. Insulin sensitivity improves too, which is why researchers point to this exact protocol for people managing blood sugar, including the type 2 diabetes patients in that Fukushima cohort, where a slowing gait showed up as a warning sign before any lab result did. Blood pressure drops for a more mechanical reason. Repeated bursts of harder effort train the blood vessels to relax and expand more efficiently, the same adaptation a cardiologist would chase with a structured cardio plan, minus a treadmill and the subscription fee. Cholesterol tends to shift over several months in a similar direction, the ratio of good to bad improving as the body leans more on fat for fuel during those recovery minutes. Gut health gets a quieter boost too. Regular moderate to vigorous movement speeds transit time and supports a more diverse bacterial population, and a traditional Japanese diet heavy on fermented staples like miso and natto give that shift something useful to work with. Sleep tends to follow the pattern any real physical exertion produces. Harder effort during the day tends to buy deeper recovery at night. There's a subtler thread worth sitting with, too. The mild mental engagement of managing pace, watching a clock, adjusting effort every 3 minutes. Keep the brain working in a way a mindless stroll never does. Slower gait speed has been linked to earlier cognitive decline across multiple studies of older adult, brain fog included. Training the legs back to speed appears to do more for the mind than a shelf full of supplements ever will. None of this demands perfection. If the first fast interval feels too hard, slow the fast phase until it's merely uncomfortable rather than punishing. Then let the pace climb over a few weeks as fitness returns. Anyone with heart disease, a recent joint surgery, or uncontrolled blood pressure should talk to a doctor before adding anything that spikes heart rate on purpose. For the average person past 70 without those flags, this protocol sits in one of the lowest risk categories available, precisely because the slow interval is built in as mandatory recovery. Consistency beats intensity here every time. 4 sessions this week, 4 the next. Not 5, then 0, then a guilty attempt at 7. The nervous system and the muscle both respond to a rhythm they can count on. And a rhythm they can count on is exactly what a cane replaces when someone starts leaning on one instead of training the legs underneath it. What actually shows up over a few months looked less like a transformation and more like a string of small returns. Getting up from a chair without pushing off the armrest, climbing a flight of stairs without stopping halfway to catch a breath, crossing a street before the light changes instead of hurrying and hoping. Those moments never make a headline. They're the entire point. The researchers weren't chasing a number on a treadmill test. They were chasing the gap between someone who can still live independently and someone who can't. And that gap was hiding inside 3-minute intervals the whole time. Frailty gets talked about like a switch that flips at some fixed birth date. The Nagano data tells a different story. It behaves like a slope, and the steepness of that slope stays negotiable much later in life than most fitness programs assume. A body already decades into decline still answered the right stimulus at 78 years old, using nothing but a sidewalk and a willingness to walk uncomfortably fast for 3 minutes at a stretch. The real question is how many years of independence are sitting on the other side of a habit this simple, and how long the slow, comfortable version of walking gets to keep convincing people it's enough. A research team in Nagano handed a 78-year-old back the walking speed of someone 20 years younger. Testing the same 3 minutes for yourself starts with nothing more than a sidewalk, a clock, and 30 minutes that were probably going to be spent sitting anyway. If this changed how you think about walking, the next video keeps going into the daily habits, keeping Japan's older generation moving longer than almost anywhere else on Earth.